today's event, showcase the exciting activities conducted by McCormack's centers and institutes, while also serving to foster UMass Boston's students and faculty engagement and collaboration with the Institute's many exciting and community outreach and research activities, projects, and programs in Greater Boston. We like to say that we provide students with an opportunity to engage faculty, students, and community partners in the process of co-creating knowledge in a variety of forms. So today's third McCormack Institutes of International and Public Affairs MIIPS Brown Bag series will feature the LeadingAge LTSS Center at UMass Boston, Gerontology Institute. And the theme of today's event is actually applied policy research making a difference in Massachusetts long-term services and support sector. The discussants will include our own gerontology clinical professor, Mark Cohen, and his team, Robin Stone, Lena Shermer, Kim Brooks, and Carolyn Billers. I'll introduce Mark, and Mark will introduce his team. Let me say a few words about Dr. Mark Cohen, who is the co-director of the LeadingAge LTSS Center at UMass Boston's Gerontology Institute at McCormack. Cohen is a clinical professor of gerontology here at the University of Massachusetts, Boston, and he is the research director at Community Catalyst. Prior to joining UMass Boston, Mark Cohen was the Chief Research and Development Officer and former president and co-founder of Life Plans Incorporated, a long-term care research and risk management company that works with both the public and private sector on issues related to the financing and delivery of long-term services and supports. Over his 30-year career, Cohen has conducted extensive research and analysis on a variety of public policy issues affecting the financing and delivery of long-term care services, and has promoted public-private partnerships in helping to address the nation's challenges. He served on Governor Deval Patrick's task force on long-term care financing for the Commonwealth of Massachusetts, and most recently, he served on the steering committee of the Long-Term Care Financing Collaborative, which recently published its recommendations for improving the nation's financing of long-term care. He has also testified several times before Congress, the Bipartisan Policy Center, and other organizations on issues related to long-term care financing and private insurance. And finally, Cohen has published widely in scientific journals, and his work has been quoted extensively. He has been interviewed by the New York Times, the Wall Street Journal, and Time Magazine as a thought leader on issues affecting elder care financing. I am so pleased to introduce and welcome our own Dr. Mark Cohen, who I like to describe as McCormack's public intellectual and penultimate professor of policy practice. Go ahead, Mark, over to you.
Thanks so much, Dina Dozy. When I hear you do that introduction, I keep looking around for who you're describing. And I guess more than anything, it says that I've been at this for a long time, and that's probably true. Most people in this field find themselves working on these issues for a very long time. I'd like to welcome everybody, all of our listeners and participants. And I'm especially happy to introduce our roundtable discussants today. So as Dina Dozy said, with me today are Dr. Robin Stone. Robin, why don't you raise your hand? Robin is the co-director of our center, the LeadingAge LTSS Center at UMass Boston, and a senior vice president of research at LeadingAge. Now, LeadingAge is the largest national association representing the nonprofit aging services sector across post-acute and long-term care services. I'll talk a little bit more about what those services are, what they actually mean. I'm also so pleased to be able to introduce my colleague and friend, Lena Sharma, who is the Deputy Director of the Center for Consumer Engagement and Health Innovation at Community Catalyst. Community Catalyst is a leading nonprofit national health advocacy organization dedicated to advancing a movement for health equity and justice, to shape and influence policy and practice. And one of their areas of focus is in the field of long-term services and supports for older adults. So welcome, Lena. Kim Brooks is the Chief Operating Officer of Hebrew Senior Life, which is a Boston-based premier multi-service provider of services for older adults, including senior housing, assisted living, home and community-based care, rehabilitation services, and nursing home care. Hebrew Senior Life is a top provider of senior care in the Boston area and a national leader in redefining the experience of aging. And last, but certainly not least, is my colleague, Carolyn Billers. Carolyn is the executive director of the Massachusetts Senior Action Council, a statewide grassroots senior-run organization that empowers its members to collectively address key public policy and community issues that affect their health and well-being. So before we get started with our discussion, I thought I would just take a very few minutes to tell you what this research center is all about, the LeadingAge LTSS. I'm going to abbreviate, otherwise it's too much of a mouthful. Long-term services and supports, I'm going to refer to as LTSS. So this center, our center was established in late 2016, and it represents a very unique partnership between two organizations. First, there's the university and LeadingAge, which is an industry trade association based in Washington, DC, and comprised of more than 6,000 nonprofit organizations providing health and housing resources to older adults globally. We work specifically with the research group in Washington, DC that Robin heads up. And we really partner with what I consider to be a top-notch dedicated group of applied researchers at LeadingAge. Second, we partner with Community Catalyst, and as I mentioned, a national healthcare advocacy organization that's really dedicated to universal health coverage and a consumer-oriented healthcare system that is responsible to vulnerable and underserved constituencies. Now, Community Catalyst has relationships with more than 40 local advocacy organizations around the country. And as part of my role is to serve as the research director. So the purpose of the center is really to improve the quality, affordability, accessibility of long-term services and supports by transforming the way that these services are financed, delivered to, and experienced by seniors and families. Now, many people are not actually familiar with the term. Like, what does LTSS stand for? What does it actually mean? It actually has great relevance for everyone who's listening today. First of all, LTSS stands for long-term services and supports. And these are a set of supportive services that people often require as they age, or if they're younger and have disabilities that prevent them from living without help to perform basic living activities. So typically, LTSS services are designed to compensate for functional or cognitive issues, like, for example, the inability to perform daily living activities, bathing, dressing, or being able to even ambulate outside of your home and so on. These services are typically include home and community-based care, where people may come into your home and help you with these services, or assisted living care, or for people who really have major dependencies, nursing home care. These services are primarily, unlike medical care, they're designed to be supportive and not necessarily curative. The other unique thing about long-term services and supports is that most of them are actually provided by family. And there are paid caregivers, but most people who require these sorts of services receive them from family and friends. And I want to make the point here, which I think speaks to the relevance of what we're trying to accomplish as a center. 1 in 2 people that turn 65 can expect to have a need for LTSS before they die. And the cost of these services can be really high. For people who have to actually pay for services or have services paid for on their behalf, they can cost up to $250,000 in 2020 dollars. So and a lot of people can't afford this. So think about people who save all their lives, they end up spending a lot of their money on their care. And when they run out of resources, the social safety net Medicaid has to pay for some, but not all kinds of LTSS. So given the changing demographics of our society and the growing number of older adults, LTSS represents a growing challenge to individuals, their families, and to state and federal policymakers. And it's a policy that really requires significant attention in order to assure that people, when they age, get what they want, which is typically the desire to live in their own home and community in dignity and peace of mind, without facing financial ruin or having to live with significant unmet needs. So for that reason, we focus a lot of our efforts on applied research with practical implications for policy and practice. And to that end, we focus on 6 major areas. And we're going to talk about 3 of them today. There's housing with services, consumer engagement in LTSS, policy and practice, workforce issues around the people that we do pay to come into our homes, nursing homes, financing, and aging and health. We have offices in Boston and Washington, D.C., and we obtain external funding for most of our activities. We work closely with policymakers locally and nationally. And this unique partnership creates internship, professional and educational opportunities for students in Boston, here, potentially Community Catalyst, and in Washington, D.C. And it expands our opportunities to work with and train the next generations of leaders in gerontology, aging services, and applied research. It also enables the university to conduct research and pilot projects with both provider and consumer and community organizations. So that's background. What I thought we would do today would be to discuss some of our work with the partner organizations that we have represented with us today, to give you a flavor for some of the types of issues that we've been addressing, the nature of these collaborations that we've forged over the past few years, and frankly, how the center is furthering the missions of the university, LeadingAge, and Community Catalyst. And we think and hope making a real contribution to helping better the lives of vulnerable older adults. So the best way to do this is to have our panelists talk about specific concrete projects that we've undertaken under the auspice of our partnership. And I'll probably ask some questions about some of these projects. I'm going to dig in right now. What I'd like to do is maybe begin with one of the very first projects that this new center undertook back in 2017, and that was with Hebrew Senior Life. They were in the midst of developing a new program for adults living in senior housing, and they were looking for a partner to evaluate the program and the impact it was having on residents as well as on the healthcare system as a whole. It's called the R3 program, and actually I'm gonna let the real innovator here and developer of that program, Kim Brooks, talk about it a little bit. Kim, can you describe the R3 program for our listeners and what you were trying to achieve with the program, and why you came to the center at UMass Boston, and what was our role?
Sure, I would be happy to. This is one of my favorite things to talk about. Also a bit of a mouthful. R3 stands for, the long version is right care, right place, right time, effectively integrating senior care and housing. So a little long, so we go with R3, but it's really all about, you talked about a lot of different settings, Mark, and this one is very focused on seniors living in an independent setting. So they're living in an apartment. It's not assisted living. It's not long-term care. They're living in an apartment building, but sometimes could be 100 seniors under one roof, a couple hundred older adults under one roof. But they are, they may have some of these services and supports in place, but they are truly living independently, and their goal in many cases is to stay in that independent setting for as long as possible. So our whole program has been focused on leveraging that congregate platform of housing and bringing the right level of services and supports and integrating care in the right places to keep people out of the hospital and out of long-term care. And a couple of the big challenges that we were trying to solve for are, one, what's an efficient and effective way to do that? These apartment buildings or housing complexes tend to have very small team of staff, maybe a maintenance person, property manager, maybe a social worker, so very light on staffing. What's the right way to add and supplement that in a proactive approach to keep people well and independent? And then how do we prove out the value of that so that we can get the health plans to pay for it? Because you have housing sitting over here with, very little resource, but this incredible platform. And then you have all the health plan dollars, sitting over here and the motivation to get to savings and outcomes. So trying to figure out how we pull those two things together. So we created a demonstration program over the course of about 4 years involving 7 affordable senior housing sites. It was home to about 1,100 older adults, and embedded a wellness nurse and a social worker across those sites. And they were very focused on a whole host of proactive activities like doing assessments on people and proactive outreach, regular check-ins with them, things like falls prevention, medication adherence, helping people with transitions if they went to the hospital and came back, translating, communicating, and coordinating between all the different people that are part of their care system and part of their life. And then really developing partnerships with, whether it's emergency responders and utilizing all the data that they have to track and trend and try to help keep people out of the emergency department, partnering with the providers, with the mental health providers, with their physician, their family. And then in addition to that, testing out a payment model with the health plans. And so we actually contracted with health plans where they would pay us a per member per month. We would mutually agree on what outcomes we were trying to achieve. And then it was our job to, go out and try to solve for all these things. And they would leverage us as basically extensions of their teams to get these things done. And one of the most important parts of our work was to make the case to the insurers. They've always felt like there was value in a model like this, but they always said, you've got to prove it. And in affordable housing, tracking data is not one of our strong suits, not something we tend to do really well. So that's where the LeadingAge LTSS Center came into play, and was not only instrumental in us achieving what we achieved, but really the evaluation that came out of this work and this partnership has just changed the course of this effort completely. So I can't say enough about that. Just a true partner from the beginning, having a group that really speaks the language. We were all speaking the same language. It didn't feel like, research over here and operations over here. It was kind of research through this operational lens, and really helping us shape the assessment questions that we were asking people, the data, the tools that we were using, and the way we were tracking data to make sure that at the end, we were going to have something that was able to be evaluated successfully. And certainly having such a strong knowledge of the industry and the payment system just made the whole design of the research and the evaluation so much more effective. It really, we were able to do pre-post analysis. We were able to go to comparison sites, and again, knowledge of all of the local players and who we might reach out to for that and how we would get that data. And then having the quantitative and qualitative components of the research, all of that just really spoke the language that we needed to speak to the insurers. So when we got to the end, we had results. We couldn't have asked for stronger results. So we were very fortunate that it ended up, proving out what we had hoped and expected, and really did make the case. So, now at this point, we're in replication mode. We're out adding additional housing sites. We've been able to continue with all the ones that were originally in the demonstration. We have been able to activate multiple health plans to join in that payment model and those discussions with us. And then we're gaining some momentum at the state and hopefully the federal level on funding mechanisms that would really leverage this platform of affordable senior housing. So we've been so thankful for the partnership.
So Kim, just a couple of quick, thank you very much for that overview. A couple of quick questions. First of all, we were called in to be evaluators. So when you're called in to be an evaluator, you're always much more popular when it turns out that the goals of the demonstration are actually able to be proved out. And in this case, that did happen. We had students participate in this project. What do you tell us a little bit about what that was like, having some of our graduate students be involved heavily in the qualitative analysis, even some of the quantitative analysis?
Well, I know if my colleagues were here, they would be screaming thank you for the students, because we too had a very small team working on this, and the level of time and energy required to do those assessments was just incredible. And the students were so helpful, able to leverage them to get out there and help with those. And not only just getting the work done, but we also had a very diverse population that we were serving through this model. And many of the students were bilingual and were able to actually handle the translation and doing those assessments with non-English speakers. I also found it really interesting. There were so many different perspectives of the students, and they actually helped shape the work, helped us think about different approaches, and that I think just added a level of interest to the work that we didn't even expect.
And just maybe one final question, and then we'll move on to our next example and leave plenty of time for discussion. But there are people don't often think of just some of the general advantages of partnering with not just an outside organization, but a university-based organization. Were there, how did that work for you guys, Kim?
Well, I mean, we actually have a research center in our organization, but the value here of partnering with an outside group just brought so much credibility, and being part of the university and having the recognition that you have locally. I mean, it was so powerful to have you by our side whenever we were out, whether it was going to funders. I mean, the Health Policy Commission was a major funder of this effort, and certainly the credibility that you brought to just the work that we were doing, very impactful. The national impact, being able to have that, again, that proof, and what all of our insurers were looking for. And I think just the access to so many, just people with varied experiences. You had so many different people that were able to join into this effort and bring expertise in focus groups or payment models or all the different aspects of the work. And it just really, I think, elevated the level of what we were able to do.
Great, thanks. Well, I can speak for the entire research team. This project was truly a labor of love, and I was joking before we opened the session with Kim about, I'm not sure if they learned from us or we learned from them, and it was obviously a lot of both. But I want to emphasize, especially for students, the incredible advantages of being involved in the conceptualization of applied research, actually doing it, sort of seeing how the research sausage is made, I think you can teach it in the classroom about the principles, and you want to apply those principles. But then when you have to apply it in the real world, like, hey, why isn't everyone participating in this assessment process? You know, or how do we get people to answer certain questions? And you have to be, you know, there's a scientific literature around that. And then you also have to be very flexible and facile in your approach. And Hebrew Senior Life presented just a terrific opportunity, and it was a joy. And Kim, thank you so much for being with us today. We're going to move to Lena and Carolyn right now, and we'll have plenty of time for questions at the end. Now, Lena, you and Carolyn are working with the LTSS Center on a very interesting project, very different project, and it's looking at engaging older adults, including those drawn from underserved communities, to help set policy priorities on issues related to LTSS financing and service delivery. Can you describe the project for our listeners, its purpose, you know, who is backing it, or, you know, who's funding it, and what you're trying to accomplish?
Sure. Thanks, Mark. And it's great to be here and to see all of you participants in this roundtable. I want to start a little bit about where we come from with Community Catalyst. So our mission is to build the power of people in creating a system that's rooted in race equity and health justice. So when you hear me talk about this project, and when you hear Carolyn talk about the work that she's doing, that's really the motivation that we come from in terms of making sure that older adults are empowered, and that they are sort of co-creators and co-producers with us in ensuring that there is a long-term care system that's responsive to their needs. This project is funded by the Tufts Health Plan Foundation, and it really stemmed from the pandemic. And I'm sure many of you, when the pandemic started, heard about older adults, the impact on older adults, those living in nursing homes, those living in the community, and especially older adults from communities of color, and just the stark disparities that they experienced in this pandemic. And so we really wanted to examine from the perspective of how is this impacting the services that they receive in their home, or, you know, in the communities, most specifically long-term service and supports. And so the project is working with Mass Senior Action, so older adults in Massachusetts, to meaningfully engage them, empower them to developing recommendations for the state, with short-term recommendations and long-term recommendations on what it is to transform the system that we currently have. And so when I turn it over to Carolyn, she'll talk about, you know, how they're engaging and listening to older adults and their caregivers on understanding what they want and need from the system, and then using that to really create recommendations for health systems, for policymakers, and also boosting advocacy skills for older adults. You know, how can they have the tools and the training to engage in this as equal decision makers where policies are being created. So I'll stop there. That's an overview and the crux of this project. And then I'd like Carolyn to talk a little bit about the work they're doing.
Thanks so much, Lena. Yeah, Carolyn, can you tell us about a little bit about Mass Senior Action and why you're partnering in this research, and then how it's actually being pulled off?
Sure. So Mass Senior Action is actually a very unique organization. We're one of only just a couple in the nation, in fact, that is organizing seniors to really have a voice on policies and community issues affecting their lives. We were founded in 1981, and here we are 40 plus years strong. And, you know, we have a very active and engaged membership of seniors, and primarily lower income seniors. Majority of our membership are women, and, you know, a significant percentage of our membership and leadership are seniors of color, who really are coming together to build a voice around justice and aging. And, you know, one of the great things, with this and why Mass Senior Action is become involved in the project is because there's definitely, shared, kind of vision and mission between, Mass Senior Action and our partners. Community Catalyst, is a national organization that works, closely with local organizations that are building power in their communities. And I apologize if you're hearing the dog in the background, but where Mass Senior Action is really people that have identified challenges that they want to change. And as Lena mentioned, the COVID pandemic has really put a spotlight on many of the structural inequities that already exist in our long-term care system. I think we heard it in the news, but to know that nursing homes had a death rate of 90 times that of people in the community, and that nursing homes with a diverse residents had a 25% higher death rate than those that were predominantly white. And again, we want to kind of get to the root of that and begin to do the system change to address those inequities.
Oops. Thanks, Carolyn. Can you, just practically speaking, how are older adults being engaged in this research? How are we pulling this off? How are we getting to raise their voices? What are the actual methods by which you're doing that?
Sure. So, older adults or seniors have been engaged, kind of from the beginning to kind of begin to think about some of the issues, to, really coming together. We have had listening sessions with groups of, 8 to 10 older adults from different parts of the state. To really give people a chance to discuss what are some of their experiences with the long-term care system, what have been some of the challenges, and what is some of what their vision is. What would they like to see? What would they like to have access to if, resources were not the limiting factor? And particularly for lower income seniors, as Mark said, people want to age in place, they want to stay in the community, but far too often they don't have the resources, and the systems that we have really kind of push people into facility-based care. So in addition to kind of these listening sessions, and I think one thing that has been important
I'm thinking that Carolyn is frozen right now.
is that,
Here we
some of those listings.
Carolyn, I'm thinking that you may be having some internet connectivity problems. So it may be worthwhile to come out and maybe come back in. And I was going to make a point also about these listening sessions, which I have listened in on a number of these, and it is really interesting to see how, when you've been involved in this area for a long time, and you have certain views about what is and is not important, and what really matters to people, how wrong you can be. And you really have to have a certain amount of, when you're doing applied research, your strongest skill are these things, these two ears, listening, because we've learned quite a bit about what actually turns out to be really important to people. So one piece of this project is these listening sessions. The other piece of the project is we're actually conducting a survey because what listening sessions do is you get a small group of people and you can go really in depth. What doing a survey will do will give us a sense for how widespread certain views and attitudes and desires are about specific policies. And here I want to just mention the role of the center, the LTSS center in this. And Lena, you can probably comment on other studies that we've done with consumer groups, which is in crafting surveys, making sure that it's done in a way where people will understand questions similarly, where answer categories make sense. So we've been providing technical assistance in that regard. And we just learned, for example, we were going to be distributing this survey across Massachusetts through community centers and so on. But last week, when we had some of the folks from Mass Senior Action on the call, they said, "Look, enough people now have internet access. Can you put this? Can you do this online?" And here's where I think we have a unique strength, being in McCormack and within the university system. So being a major research university means that we have available a whole host of tools right at our disposal. And in this case, what we're going to do is we're going to work with one of our students to develop an online survey through one of our programs. It's called Qualtrics, that the university has, so that we can then make sure to be able to distribute this survey to a much wider range of people. So Carolyn, thank you for getting back on. You were answering, I finished out, I believe, your answer on how older adults are being engaged. I had a question for you, which is, have you received any reaction from the people who've already been listened to in listening sessions or helped take part in some of the survey construction? Like, how do people feel about being involved in this whole research process?
Yes, and thank you. And I apologize for technical difficulties. But I think feedback that we have gotten so far is been positive. I think people enjoyed being a part of discussion with others and kind of hearing that there are others in the community that have had some similar experiences with them. But I think more than that, I think people are encouraged by the opportunity to really kind of focus in on some policies that get to these underlying issues. And, while they have the expertise of experience, they don't know all of the opportunities to really address the challenges. And so, I think people are definitely looking forward to kind of getting to that point so that they can then drive those policies forward.
On that point, one of the things I worry about, honestly, is that when we engage people in this kind of research and we ask their attitudes and opinions, since for those of us who are involved in the policymaking process and we know the long-term trajectory, I know it's pretty rare that things happen overnight. Are you worried at all, Carolyn, about raising people's sort of expectations about the recommendations and what we're going to come up with, and then what actually happens? And how do you manage that?
Yeah, no, I think, we have a long history of working, to change policy. And while we would love to see it happen overnight, and we would love to be able to just tell policymakers, hey, here's the problem, and look, we have this solution, we know that that's not the reality. The membership of Mass Senior Action is very committed and really, driven to kind of see things through. Right now we are on the kind of brink of passing some significant policy around expanding access to affordable healthcare. that we actually started almost 10 years ago in developing that effort. And, not all of the members who started the campaign are still with us, but many of them are and are still providing that leadership. I think being able to be a part of it and not just waiting for someone else to deliver the results is, I think, a significant factor in that.
Boy, that is such a good point. Thank you. Thank you so much, Carolyn, frankly, for all that you're doing for Massachusetts seniors. It's a good model for organizations across the country. We got a lot of good things going on in Massachusetts. So that's probably not the best pivot then to my my colleague, Dr. Robin Stone, and she's a colleague, she's a co-director and friend. Really, Robin is an icon in our field, having served at the highest levels of government in Washington, D.C., developed multiple programs and approaches for improving the delivery of care for older adults in really a variety of settings. I'm so glad you could join us, Robin. Some of your recent work has focused on the issue of the LTSS workforce, issues related to training, job ladders, and the critical importance of pay. That is, what does it mean to actually pay people in this field a living wage, what that might accomplish? Can you give us a little bit of background on this study?
Sure.
Thanks, Robin.
Sure, I'm really happy to be with all of you. And I want to reiterate something that Mark said earlier, which is that in many ways, we have a very unique center at UMass, because this is the first, we really looked around to see what models we could put together when we were coming together, and we didn't really find any. So we are working through this center process all the time, but we are an organization that actually has over 6,000 aging services providers. And the reason that I went there 22 years ago was to look at what is the potential for these natural laboratories for us to learn about what works and what doesn't work, and how do we take that back to improve policy and to improve practice. And so our research group was already together, and then with the addition of the partnering with UMass Boston and the Gerontology Institute to really create this organic center has given us so much more depth and breadth, both from the academic perspective, the access to students who, by the way, have been involved not only in many of our projects, but also right now, for example, some of the students are doing podcasts around some of the workforce challenges, and podcasts with our providers, which then we use to get out to the field for people to understand what's really going on. So the students are developing their interviewing skills and their development of podcasts. We're using those materials to actually advocate and spread the word around the challenges and the opportunities for improving the workforce. So I just want to underscore the importance of this and the uniqueness in many ways of this two-way, three-way partnership, because we've actually had we've had a three-way housing project with Community Catalyst that we don't have time to talk about today. And then I'd also want to say that Hebrew Senior Life is a member of LeadingAge. So we have all of these connections to go back to the partnership piece to really understand how that partnership between academia, in our case, a large association, and then all of the community partners really makes it, these parts are bigger than the sum. The whole is bigger than the sum of the parts. With respect to this one particular study that we did, I hate to say this, Mark, but actually my own work on this workforce issue goes back to the early 80s. That's how long we have been working on the challenge of improving the frontline workforce in particular. And these are the low wage, I call them the low wage professionals who actually do 60 to 80% of all the paid work in our sector. These are home care aides, personal care attendants, certified nursing assistants, dietary aides, the frontline, largely people of color, who have been seriously undervalued in our sector. And the COVID not only showed the challenges to the older adults, but COVID has also shown the challenges to these essential workers. They were much more likely to get COVID, were much more likely to die from COVID than other groups. And in particular, those who are people of color, 25 to 30% of this workforce are immigrants. So this is a serious equity and justice challenge. And one of the biggest issues around this is, what do we do about wages? And so here's an example of how our organization came together with our UMass partners, Mark and Christian Weller, both health economists, and Beth Almeida, worked together to actually model what would happen if we increased the living wage for all direct service professionals in the United States. So in 2022, what would this look like? And what we found, without going into all of the data, and what I would highly recommend for any of you who are interested, is to go to our website, www.ltss.org, which is another wonderful cooperation between all of our centers to have created this website. But the data from this report actually show that not only do we get 75% of all the workers would have substantial increase in their wages through a living wage process, but also the benefits to providers, we would see significant reduction in turnover, which is a major challenge for the aging services providers. And we're seeing that right now. Recruitment is impossible. We're in an extremely challenging environment, and the living wage would really give us an upper hand in terms of being able to compete in not only our sector, but compete with other sectors as well. But the implications for the providers, the implications for the local economy, the fact that when you put money into the hands of lower wage workers, they actually spend more in their community than their higher wage counterparts. And so by giving everyone a living wage, we're literally giving this workforce the ability to purchase more in their community and to therefore contribute to the economy through paying for goods and services, paying taxes, which generates revenue for the state and local communities. And so the benefits are attributable to everybody at a fraction of what the costs of LTSS are, and what in terms of what we pay out in the United States. So the bottom line for all of this is this living wage report went viral. We had it all over the news and social media. We had a blog in Health Affairs. We had a number of different avenues for getting this out. And the Biden administration really picked up on this living wage report and was actually used it to inform all of the policy actions that they have done, including the Building Back Better proposal, which has been stalled, but I think ultimately a part of that is going to move forward. But it also had an effect on how many of the states are now thinking about using their ARPA funds that have come through as a result. This is the American Rescue Plan Act funds that are now being used by states to look at how they improve home and community-based services. So the extension of what we all did as a center, the effects of this on informing policy and getting people to really be aware of what is the potential for actually moving towards a living wage in the future, I think is a perfect example of how the power of this kind of a center, the use of both the academic as well as our team that are in the trenches in Washington, D.C., and the students that we work with, how we build these kinds of models and then get the information out to both policy and practice.
Thank you so much, Robin. I mean, that was such a fun project. You mentioned just for a second the connection to Community Catalyst on the housing project. I mean, from your vantage point, how common is it, or what unique opportunities are there when you have a university, a provider organization, and a consumer-focused organization all together in partnership.
Yeah, I mean, it is really an example of how we all should be working. If you think about it, we have access to many housing providers because a third of our membership are low-income, affordable senior housing providers like Hebrew Senior Life. So we have access to these laboratories. At the same time, Community Catalyst has access at the state and local level to community folks who actually could get us access to residents to interview, as well as having the tools to actually do the focus groups that we needed to do on this particular housing project. And then we have the academics to bring the rigor around setting up the questions. How do we do this? And in this case, we were trying to understand, what do lower income older adults want? What type of services would they want to be linked with? What is the value of living in a congregate environment and to bring services in or to be linked with services in the community? That was the purpose of this. And one of the pieces of that was really to do these focus groups, which, by the way, when we got this program going, we thought we were going to be able to do in-person interviews, but alas, COVID happened. So we had to go virtual. And this was the first time that any of us had really done virtual interviews, particularly with low-income residents. So this partnership between UMass Boston, our team out in the field, and some of our affordable housing providers, and Community Catalyst and their team actually getting the residents, it was just a fantastic experience. There's nothing that you can learn more than hearing it from the voice of the consumer, who is either residing in one of our organizations or is living in the community and perhaps thinking about the potential of moving into a congregate environment. So I think it's a perfect example of how we brought academia, the provider partnerships, and the community partnerships together. That very rarely occurs. And I think kudos to UMass and the Gerontology Institute of actually being forward thinking in terms of putting this center together, because it is a unique set of players.
Thanks so much, Robin. I think at this point, I'm going to turn the program back so that we can take questions. I think, Chris, you may be the moderator for that. And we'd be happy to take any questions that people have about anything that has been said or has not been said.
Sure.
You could indicate by raising hands on the screen, and then Mark, you could take the questions as they pop up.
Okay.
Also, if you want to type in the chat, you could drop your questions in the chat as well.
And don't be shy.
Yeah, don't be shy. Otherwise, you're going to have all of us thinking that we spoke so clearly, we made every point, and you don't want us thinking that. Dina Dozy.
Yeah, I'm a bit shy because I don't know. You know, I'm enthralled by the learning that I have achieved in listening to all five of you talk about this really fascinating topic and world that, you know, I should be much more immersed into, but I'm not. So, you know, I want to commend all of you for the work, you know, really important work that you're doing, you know, fascinating. And this is all, you know, under the rubric of McCormack, one of your partners, you know, all the same. But I'm so proud to be associated, you know, with all of your organizations, and the fact that we are partnering with you to engage really critical, serious social issues and impact. So thank you for that. My question in listening to, you know, really the policy dimensions of your discussions was to what extent, and I think this question is for you, Kim, and you know, for you, Carolyn, and Lena, and Robin, about, sort of the intersectional questions of policy action. Unfortunately, at the forefront of policy discussions, we don't hear enough about support services for the elderly. We just don't. So to what extent, does your work, or, to make your work more effective, do you see the need to intersect, some of the policy action issues with, major national issues? Let me be more specific. For example, Robin, you were talking about, the importance of, raising the minimum wage, for example, wage equity. I'm very much involved in advocacy around wage equity for women. But I never thought about, essential workers in this, field, and how that intersected and how it was important to raise that issue as well. So that's just one example. I think Lena or Carolyn talked about most, of your LTSS essential workers are people of course, we just didn't dawn on us, but, there it is. So this engages, questions about, diversity and, the importance of why, closing equity gaps is as important as the work that you're doing. So if you could just talk about intersections of policy and action with, other major issues. Thank you.
I could start real quickly, just really quickly about this. I mean, what this is, the lower income older adults and their families and the frontline workforce are all incredibly vulnerable. And, it's exacerbated by the aging of our society, which is, you can celebrate longevity, but you also have to recognize the challenges of what that means for living into old age, needing services. And if you are lower income and you are on a fixed income or even less, or you have marginal housing or no housing, by the way, the fastest growing homeless population are older adults, then all of these intersectoral efforts have to come together around addressing the problem. So here you've got housing, you've got services, you've got the paid workforce. We haven't even talked about the family, but they all have to come together. It's a microcosm of the challenges that we have around equity, and all of this DEI activity has always been there. For our sector, I think COVID just exacerbated and uncovered for many people the things that many of us, including every single one of us who's in this frame, have been working on for years. And so the intersectoral issues and the potential, I think, for the university in terms of the intersectoral departments that you have to bring these issues together to address all of these challenges. We can't solve this unless we solve the low wage problem for the frontline workforce, and we solve the housing for low income older adults, and we solve the access problems that Carolyn is working on for low income older adults, and they have to come together. So that, I mean, it's a perfect microcosm for the challenges that we have.
Lena, did you want to say something as well?
I was just going, from our perspective and the model that Community Catalyst really deploys is about co-producing policies and practices, how that is, actualized with people who are most impacted. And so we work with organizations like Mass Senior Action across the country to stand up campaigns and implement, train organizations and people so that they can sort of be equal partners in policy and practice change, whether they're doing it through government change or they're doing through health systems change or private, any private system. But it is really foundational to how we think about creating this more systemic advocacy system, and ensuring that people are well informed. And I think Carolyn can talk about it just from her all the experience that she has, not just with us, but just the work that Mass Senior Action has been doing for years in making sure that it is the older adults, that her membership, that actually have the power to wield these decisions and be a part of these decisions.
Yeah, no, thank you, Lena and Dean Andozi. I think intersectionality is an issue that is very important. As you talk about, the work that, focus on wage issues, the members of Mass Senior Action were the low wage workers of yesterday, right? Many of our members worked in healthcare, thinking about Rashida, who spent, over 30 years as an LPN at Mount Auburn Hospital, and now, can't afford her healthcare and, her rent and food. And so, the issues that we're talking about, disproportionately impact lower income seniors who were lower wage earners, but also, really disproportionately impacts women and women of color in particular, because, lower wages during their working years leads to lower incomes. Women are less likely to have someone else who can provide care for them. Often they are the caregivers. And so they're more likely to end up in facility-based care. There's a lot of issues around the way income works in retirement, that, they lose, second incomes and all of these things. So, I think, it is really important to be thinking about how all of these things interconnect. As an organization of lower income seniors, we have worked on campaigns in partnership with the frontline workers, helped to unionize PCA workers, 10 years ago, are fighting for home care workers to have a living wage and to have benefits, because, seniors also know that, quality care is going to come from quality jobs. If you're not being respected in the workforce, it's hard to then pass that respect on to those who you're providing care for. So there's definitely a lot of intersection across many issues.
Thanks, Carolyn. I'm gonna, Kim, unless you wanted to chime in, I'm gonna take our next question. Charlene, go ahead and ask your question.
So hi, I'm Charlene New. I'm a graduate of the Master's in Gerontology program at UMass. So I'm excited to be on a call with such amazing people doing amazing things. And so I got to gerontology first as being a public policy person, and then completely changing my career path because my mom got diagnosed with dementia, and I became a gerontologist. And I love the conversation today, especially about partnering and kind of moving out of silos into working together to look at aging as an issue that affects everybody. So what I was wondering is, for those of us who've been in the gerontology program or are in the field, how do we collaborate with you? How do we filter information to you? How do we, kind of filter some ideas into you that we see as practitioners in the field? I'm kind of in a sweet spot about doing practitionering as well as kind of thinking and writing about stuff. And I feel like sometimes what happens with public policy is that people making policy don't experience what the impact of the policy is. And that the anecdotal and story telling about this is really, I think, really important. So that's my question. First of all, that's my question. Secondly, thank you so much. I'm so glad to be here. And thirdly, keep up the good work.
So thanks very much for that question. I may punt it over to my colleagues, but before I do, you raised something about in my own mind, which is that I almost feel like a reformed sinner. And by that, what I mean is most of my career, most of my research was, with data sets and quantitative analysis. And when I came to the Gerontology Institute and Community Catalyst and began working with Robin, I came to understand how important that point you were making just now, Charlene, how important it is to actually bring in what we typically call the qualitative dimension, which actually turns out to be even more important than what you might have imagined, and making sure that voice is heard. So I think that certainly I know in the gerontology department, our emphasis education is on mixed methods. I hardly ever do any longer just quantitative analysis. It always has a qualitative dimension. On the issue of working, with practitioners more closely, I'll give that some more thought. I may punt that to to Kim, to Robin, or to others if they have any thoughts. I mean, clearly there's always, hey, we think we have a great website. We get people communicating with us, throwing us ideas. So that's a definite way to do that. But maybe my more creative colleagues have some thoughts.
Yeah, I don't know. I mean, I think there is so much value to the qualitative component, as you said, and, the storytelling. I mean, we certainly, in our work, the insurers want to know the numbers, and that's all important, but we get a lot more traction by telling stories and telling the impact of the direct consumer experience. We also have taken the approach of this kind of surround sound approach, and just we keep talking about it to all different audiences and trying to find what resonates. And I would love to creatively think about how we get, to your question of like, how do you funnel that information? I mean, it feels like we have such great partners in the field, like the, LeadingAge LTSS Center. And I think that is a great central repository for that, because it's a really good opportunity to get that information all back out to all of us who are doing this work. So Robin, not to add to your, Robin and Mark, to your workload, but I think that's a role that you've played, is really pulling all that together and being one central place where we can kind of work from.
Yeah, I mean, I think that, unfortunately, if you are an applied researcher and an advocate, which is kind of an odd combination, but certainly it's been my whole life. You have more ideas than you can. I mean, it's like being a kid in a candy store. So it all goes back to how much time we have, where money comes from to do some of this work, who the partners are in the field that we can get. That's the beauty of having these partnerships, because we can get to the real people and actually get more of an understanding of what's really going on. I mean, I worked in the federal government, and I know that many policy people are often 30,000 feet away from understanding anything that is going on, even well-meaning people. So we are open, I think, to hearing from you. We don't really have we don't have an interactive feedback loop on that website for really getting input from folks out, but we get a lot of traction from our website in terms of getting folks who use our materials. And we certainly we're open all the time to talking about how we work together to sort of do more applied work and then help to get it out. I mean, that's how these partnerships happen. Sure. So
I think that's good. I mean, I think that there's people who just aren't part of a group
Mhm.
that you're missing out on. And I think it's been something that I've raised frequently with a lot of people at UMass, and it's group oriented. But I also think that there's a lot of practitioners in the field who are doing research and writing that just don't belong to LeadingAge or belong to something else. And I think it's a two-way street. And I get we're all busy, and I get you've got to focus where you're focusing. But I think, and I worked for the federal government. I worked in Capitol Hill. I ran grassroots coalitions, and as you know, and I'm not always a numbers person. But I can pitch a story, and that's where it comes from. And sometimes I think we come up with these policy ideas without tailoring it to what people really need. And maybe if we kind of looked at what people are contributing, and just even an intern or a grad student, taking a look and saying like, okay, so here's level 1, here's level 2, here's level 3. I think we just might be missing out on stuff, and I think people just want to help. And I think a lot of people I know who graduate from the program would be willing to just send you information or just help you if you needed some help.
That's a great point, Charlene. And if it's okay to say this, you should go on our website, and I'll put it in the chat.
Sure, I can do that.
We work with, for many of our projects, we collaborate with experts in the field, such as yourself. We've engaged providers and practitioners in advisory councils. We've asked them to speak on panels. We've collaborated to reach out to communities that you serve, and get feedback and lived experience that way. And so I totally agree that from our perspective, as we're pushing policies forward, new policies forward, or we're trying to implement policies that are already in place in a way that is meaningful, we've always found it really useful to collaborate with a whole range of stakeholders to make sure that it's just done right.
Great. Thanks so much. Thanks so much, Lena. Are there other questions at this time?
If there's no other questions, I did have one thought, which would of course make more work for you all, you and Eddie at UMass, but thinking a little bit more about how you might use the alumni of UMass. I mean, there's so many. We actually work with quite a few of them, and actually some of the UMass alumni came to work in our research group at LeadingAge. So, maybe we could have a thought about how we might do better at something around an alumni focus on connections to the center and some of the work that we could do together, because that would be another way to get you in, to then have you filter your ideas and then connect with others. So
yeah, that's a good point, Robin. Thank you, Charlene, for your question. If there are not other questions, I'm going to turn it back to Chris, and we may be coming close to wrap up.
Yes, exactly. So at this point, we could, Dean Dozy, if you had any remarks that you wanted to add, and then we'll move to Professor Miller, who will give the closing remarks.
Well, no, I just want to, say thank you to all of you again, for what has been a rich conversation, but also a learning experience. So thank you so much. Robin, to your question about alums and engaging alums is prescient, because just this morning, I and other deans had a really great conversation with our Vice Chancellor of University Advancement. And, the university is doing pretty well in its campaigns, but one of the low areas is alumni relations and alumni giving. And so he concluded the meeting with a carrion call that we do exactly that, what you propose, which is find a strategy to engage our alums, better. I went back to the office, having that on my mind on how to do. So thank you for that proposal and suggestion. And maybe we should be reaching out to you and your partners here and helping us, facilitate, your plan. So thank you for that. But let me introduce our chair of our Department of Gerontology, the great Professor Miller, to provide his own remarks and perhaps closing remarks for this really important session. Thank you, Eddie.
Thank you, Dina Dozy, and thank you everybody for participating today. This is important and interesting work, not just for me personally, but for the university, for McCormack, and for the gerontology program writ large, and it's very much appreciated. Just want to say that, begin by saying, the unprecedented rapid aging of the population has created demographic forces that are fragmenting traditional intergenerational norms of support, often in the absence of public efforts that facilitate elder social participation and their ability to age well. And variability in the development and implementation of successful programs and policies that provide older adults with opportunities to participate in their communities really presents challenges with maximizing the well-being of older persons. And combined, finding the right balance in forms of retirement security and long-term services and supports, maximizing opportunities for aging at home as long as possible, along with promoting older adults' efforts to remain socially, physically, cognitively active, are recognized as important components of well-being. And so too is addressing the needs of an increasingly racially and ethnically diverse older population by documenting, acknowledging, compensating for, and ultimately dismantling the oppressive systems and structures that unequivocally and disproportionately impact people of color throughout the life course and into older age. The LeadingAge LTSS Center at UMass Boston helps to make the university a leader in engaging with communities throughout the Commonwealth and elsewhere to jointly develop, implement, disseminate innovative strategies and solutions to better address the challenges and opportunities posed by population aging as a leading anti-racist and health promoting public university. Indeed, I would argue that the LTSS Center is a model for how this work should be done. The center generates critical research and evaluations across a range of important areas affecting older adults, their families, caregivers, and communities. Notable examples involving housing, DEI, community engagement, the LTSS workforce were touched on today, but which more broadly include identifying and demonstrating and assessing promising workforce development and improvement practices, finding solutions that enable older adults with low and modest incomes to age successfully and safely in their communities, helping providers, regulators, policymakers ensure that nursing homes provide the highest quality of care, finding new LTSS financing approaches that are high quality and community-based and protect families from economic peril, building a robust evidence base for new approaches that improve population health throughout the lifespan, and engaging older adults in its work and guiding other organizations in the field to do the same. Drawing on this knowledge and expertise, fellows and staff at the LTSS Center provide timely data, insights, and information that informs policy and practice at all levels, ranging from the local, state, and regional to the national and global. Notably, the LTSS Center promotes collaboration, not just among researchers, but critically across the researcher, provider, and consumer advocacy communities. A truly unique undertaking and partnership that brings together the key constituencies needed to further develop and adopt and implement comprehensive strategies needed to improve the lives of older Americans. The LTSS Center furthers student success, providing research and service learning opportunities for students and generating significant resources with which to support them financially during the academic year as well as during the summer. By helping to train the next generation of scholars and leaders in aging, as well as through its scholarship, evaluation work, advocacy, service, and community engagement. The LTSS Center helps to make the Gerontology Institute and Department, McCormack Graduate School, and University a hub of innovation and learning in addressing population aging, one of the foremost issues of the day. Personally, I greatly value the opportunity to work alongside and collaborate with such a great group of scholars and practitioners as Mark and Robin, Kim, Lena, and Carolyn, as well as students who share the mission to conduct studies and evaluations that serve as the foundations for government and provider action to improve quality of care and quality of life for the most vulnerable older Americans. So I'd just like to conclude by thanking you all for attending, and to please, reach out to any of us if you'd like to learn more about what we do. So thank you.
Well, thank you all. Mark, do you want to say some closing remarks yourself?
First of all, thank you, Eddie, very much for that. I mean, this has been, I think, for all of us, really enriching. And I did not imagine I would have so much fun and enjoy myself on a Friday afternoon at the end of the week at 2:30. But I was wrong. Once again, I thoroughly enjoyed this. And I do want to thank, partnerships don't just happen. They require nurturing, they require thoughtfulness, time, and energy. And every one of the people in these squares right now have been committed to making it work, always beginning by assuming goodwill in your partner. And that has led to some really successful collaborations. So, and to our students who are on the call, many of you have been involved in LTSS projects. I have a call with a student at 3 o'clock to help us get this survey that I talked about, Carolyn, when you had to jump off for a minute, getting it on our UMass system so we can reach out to more folks affiliated with Senior Action Coalition or council that can then go on the internet. And
Mark, can I just
survey.
I just want to make a shout out to Caitlin Connolly, who my team has worked with Katrine Bonner on. We finally have finished our chapter on the effects of climate change on older adults, vulnerable older adults, particularly older adults who are people of color and low income living in the community. I think it's going to be a major contribution to the whole work on environment that UMass Boston has been doing. And it's another example of, actually, Caitlin took the lead. She's a doctoral student and took the lead on this work, but it's been a fantastic collaboration, and I can't wait till the book comes out.
Well, that's great. Thank you, Robin. So, and Dina Dozy, thank you for having the foresight to put this series together. I really, really appreciate that. And I hope I don't know if these are cataloged for people to come back and look at a later point, but if it will be, I'm thinking that we will put a link on the LTSS Center website, maybe the Community Catalyst website, and Hebrew Senior Life may be interested about how collaboration works in the real world. So thank you so much. And to all of you to help with the administration of all of this.
Thank you. Thank you, Mark. And thank you, Robin, Lena, Kim, Carolyn, Professor Miller. And thank you so much, Christopher Graham and Gifty DeVolis Jackson. Thank you all. Have a great weekend and see you next time.
Thank you.
All right.